Good afternoon, everyone. So our second last speaker today is Mandy Rodrigues. She is a renowned clinical psychologist and has worked in the field of infertility for the past 24 years. A large part of her practice involves stress management and the need for a multidisciplinary approach to infertility. She's presented and published various books and articles around the subject. Let's give her a warm welcome.
Thank you. Thank you for having me. And being the second last speaker, I am honored that some of the ladies I have interviewed for this talk are here. I really appreciate you coming, and you are the story of my talk. You are the characters who tell the story. I might start crying. A lot of you might start crying. My talks are very different to my esteemed colleagues in terms of the way I talk. I feel that the forum we're in is for you, the patient, and the forum that I am taking is I want my patients to tell their stories and then to have my sip of water while they're doing that and wipe my tears, because I really, if it weren't for all you ladies sitting there, this wouldn't have been possible. So what are we talking about when we talk about loss and grief? I'm talking about from the start of a negative pregnancy test all the way through to bad news at an ultrasound, early miscarriage, late miscarriage, prematurity, death, and then perinatal loss. I mean, it's going all the way across the spectrum. This is what we're dealing with. I am sorry for the moms who have lost, who are sitting here. I've lost 2 babies, but very early miscarriages. I do not sit in the category of the ladies I interviewed for this talk. Why is it important to manage this? Is more and more patients are speaking out and empowered to talk out about this, and it has been mismanaged in the private as well as the public sector. The trauma, and you'll see a lot of the women I interviewed, is only dealt with years down the line, sometimes 10 years down the line. There's a wonderful book written about a lady who 20 years down the line, she goes to a conference and she says, I have a daughter and she would have been 20. And she goes everywhere and all she wants to do is she wants people to acknowledge this baby. And she goes around telling everyone about her, no one wants to. And she wrote a beautiful book that I got in the States about it. With the increase in ART, multiple pregnancies and complications in pregnancy where, these complications with ART are becoming more and more frequent. And I want to speak to you about, and this happens to be my niece, and a lot of these videos were posted with permission. This is her having an early miscarriage and how she was managed in the hospital.
My husband and I had the most amazing news to tell our families. I was pregnant with our first child. I was rushed to the emergency room and confirmed that I was having a miscarriage. She gave me a script and told me I needed to go to the pharmacy, get these pills, and it would help my process along. And that a gynae could only see me at 4 o'clock in the afternoon. This was at 10 a.m. By this time, my in-laws had come to be with me because my mom was on a business trip. And we spent a good part of 2 hours trying to find the gynae to see me urgently, an internal, and a scan. And my baby was gone. I didn't go get those pills because all I could think was, what if it wasn't as bad as she was saying it was? And what if I took them and then I could have saved my baby, but then I chose to kill my baby by taking those pills.
So what I did is I went onto sites like Empty Wombs and IFASA and the Angel Group, the Angel Babies of South Africa. And I was amazed at the number of moms who came forward and said, can I please tell my story about how my loss was managed and maybe how it was, mismanaged and maybe what was good about it. And I want to just show you something. So in the scope of this, I only had time to interview 11 moms. And only 3 of the 11, and this is predominantly private, never mind the public patients that came forward after the fact, only 3 of them said that their birth was actually well managed and they lost. But the rest of them, look at that, 9 out of the 11, there was no psychological support offered. Sorry, that was 8. 8 out of them said staff were very uncomfortable. Staff were uncomfortable with managing a baby that was dead. Staff were uncomfortable with helping dress the baby. Staff would actually just walk away, and I know Michelle's been involved in a lot of that, where staff have walked away, and Lucia, we've needed people to be there and help. And lack of knowledge by staff. Now, let's just go to a couple of parents that don't actually need to have any videos go with this. Important quote I stole from Michelle from Empty Wombs is that bereaved parents never forget the understanding, respect, and genuine warmth they received from caregivers. So many of the moms say to me the way that their loss of their miscarriage and their stillbirths were managed is what mattered to them. Listen to a couple of the moms' comments.
2 years ago, I suffered an ectopic pregnancy. On arrival at the hospital, I was admitted into the maternity ward because that's where all the Ghanese patients go. I came out of theatre and was placed back into the maternity ward. It was full of newborns and their moms. My baby had to be removed from my fallopian tube to save my life, but all I could hear all night was the cries of the newborn babies all around me. It was so unfair and made my loss so much harder. I could also hear the nurses whispering outside my room, "Don't worry, there is no baby in there. You don't have to help the mom."
I had a stillborn baby just over 10 years ago. It was absolutely devastating. There was no one to encourage me to see my baby or to have a photo taken or to name her. I felt totally heartbroken and empty and just didn't know what to do with myself. As the time moved on, I was devastated that I never got to see her or hold her, that I never got to take a photo of her. It became my biggest regret. It's now been over 10 years and I'm still haunted by what happened to me and how it was dealt with.
Okay.
Alizai was the daughter I had so longed for, but she would be the reason my story when life and death collide came to be. When losing a child, you lose so much more, your hopes and dreams for your child, the life you imagined for and with them also die.
Okay. Now, you can see a lot of these moms, and we're going to have one of them speak in our support zone tomorrow. In fact, 2 ladies, they're going to speak who were interviewed for this. I really suggest you come and see their talks. But you can see that a lot of these moms, like the one lady, Janice, I spoke to, 10 years down the line, she's got more children. She cannot get over the way her birth was mismanaged.
2 years ago, I suffered an ectopic pregnancy.
There is something called the Angel Babies South Africa, which 2 people I know who went through traumatic losses formed. And this is what one of them went through. I think Ty would be 8 years old now. She was saying grief is baffling. It doesn't go away, it just changes. And it changes us. There isn't this closure. There's not another child that can make up for the one you lost. And sometimes you just learn somehow to move on. And I'll tell you how she has moved on after you listen to her story.
He lived for a day, and eventually at 12:05 that evening, they came in and said, "We think it's time that you come." The hardest thing for me is that I'd had a Caesar, and unfortunately I couldn't get to him the whole day in the NICU. So I hadn't actually ever got to hold him alive. My husband ran up there and managed to get Ty's last breaths in and see him before he passed. But I think it's more about what happens afterwards. None of the nurses down there knew how to deal with a mom that had firstly lost a baby or had a baby. They want to know what's happening with the body, straight away. What are we doing with it? Where must it go? When a mother and father loses their child, it's the last thing that they would be thinking of. Think about helping us get pictures of our son or little hand and footprints of our son, and still add a lot of closure to how we feel 8 years later.
Can you see how these moms, 8 years down the line, and they're still struggling because their loss was not managed properly? And these are moms, again, not all of them, but the majority in the private sector, where we're thinking, if that's how it's managed in the private sector, what is happening in the public sector, where it's not been managed at all, which is why these programs are so important to be and to have bereavement teams in public as well as private. It was very interesting, this saying here, someone here told me about a mom who had had 8 miscarriages, and she said, I felt like a human coffin. I got shivers when I heard that, and then I saw a patient from Tanzania on Mandy. For reasons that we needed to do testing on the uterus, she had to leave her baby that was dead inside her womb from last week, had to travel to South Africa, had to have the DNC only on Tuesday. And she said those exact words to me. She said, Mandy, I feel like I'm a coffin. I'm carrying this baby inside my womb. This is my 4th or 5th miscarriage, and I want it out. I can't do this again. There are people who are suicidal who wish they had died too. It's not normal to have your child die and you grieving anniversaries into the future. And again, it doesn't matter how many kids you've got.
I was heartbroken and grieving. And it was like she didn't care. Like it was just another day at the office, just another thing that happened. I've had to grieve my baby every single day since 2014. Every day. And every time I think about it, no matter how much time goes by, my heart still hurts. I just wish that there was a little more empathy involved in all of it.
We all know Kubler-Ross's definition of grief. We know that people go through what looks like a very beautiful grief cycle in terms of the shock and disbelief, bargaining, wanting things to make sense. Do you know how many patients go through loss and miscarriage and stillbirth and are never given a reason? So they don't know. It is just, you lost your baby, I'm sorry. One of the patients I've interviewed that I'm using in a talk this week has said to me, the doctor said, and it might have been one of you ladies, shit happens. That's it. No excuse, no nothing. And the problem is, it is a relentless grief cycle. It doesn't look as neat as what Kubler-Ross said it did. It is like this. And it impacts on all areas of the person's life.
For me to talk about him. I could do it. I wanted him to be remembered. I had all these ambitions and stuff, and the memories that we're going to make, that makes it really difficult. It's like people ask you, how many kids do you have? And if you say you have these many kids and you don't include him into that, you go to your car and you cry and you feel so guilty for not acknowledging his life. He, in the beginning, found it really hard to speak about him. He didn't want to talk. And all I wanted to do was talk. I wanted to remember everything. I kept wanting to just speak about him.
But then they also told my husband that the chances of me surviving is also very slim. So he had to sign a wavering form that in case something happened to my baby, or both to me and my baby, that he would not hold the hospital accountable. My heart broke for my husband. My perfect little angel. She didn't even look sick. But the night she passed, when they told us that she passed, I started hitting my husband as if it was his fault. And I just kept screaming, "It's our baby, it's our baby." They asked me if we would like to see her one last time, and I said yes. But upon my question whether or not I could hold her one last time, they told me that I can't. I can't touch her. I can't even kiss her. So I can't even say bye to my daughter. They were talking about her as if she was a thing and not a person.
Okay. When I listen to what it does to the relationships, you can see there the two vulnerable people trying to reach out to one another, but they just can't. And I know I've probably got 5 minutes. I want to... More important than videos. There's no one size fits all. I have patients who maybe have a birth pain. They don't want to see their baby. They say to me, I can't do this. And that's where we need the bereavement counselors to come in, the anaesthetist, the nurses, somebody else who can take the pictures. Because I can promise you, I've been doing this 27 years, the people come back and they want that picture, whether it be 10 years down the line or 5 years down the line.
That could tell us that it's okay to take pictures and it's okay to take in every moment and remind you at that moment of all the things that you might forget to do. Take the footprints, or let the nurses take the footprints, because I cherish that very much. I remember his face that well. I took a photo of him in the morgue as well to try and remember his little face, but it was not the same. I mean, he's been gone for a few days, so that could.
I want to play a last video. It's the same lady who was talking, and she had a baby who died after a few days in the ICU unit. I think it was 20 days. And she gave me permission to play this 1-minute clip of her trying to plan a funeral for a baby that was still breathing. I had a mom a few months ago who had twins inside her and her membranes ruptured at 21 weeks. And she said to me, Mandy, how? These babies are kicking, they're happy, I can see them on the scan. Her membranes had ruptured, they weren't going to live. She didn't want them to come out because they were alive and they were healthy, but they were going to come out and her life would have been at risk. And I just want to end off with this 1-minute clip.
We had to start planning the funeral. It was my last thing I could do for him as a mom is to at least speak on his funeral. There was no one else that really knew him that well. And then again, after the funeral was done, it was really hard because everyone goes on and you feel like time has stopped for you and you're stuck. Like you have all these little memories together with him, and I was very, very heartbroken. And everyone else just carried on with their lives, so it was very difficult, as though no one remembered him, as though he never meant anything. But to you, he meant the world.
Just shows how important this journey is at the end, and I find it so poignant that he was crying at the end of that while she was busy planning his funeral because they were going to switch off life support. Finally, literature says that there is an enormous journey of infertility, pregnancy loss, stillbirth, and NICU on the mother, the emotions on the mother and the father. Notwithstanding bed rest. Don't underestimate what bed rest and having to be on bed rest prior to a lot of these babies being born. The mothers are already on bed rest. Grief cycle, depression, post-traumatic stress disorder. these must have been triggers for you ladies, for all of you. You go past the maternity ward, you go past the clinic where you conceived your baby, or the gynae, and patients are being lost by gynaes in public and private. And whereas if we can train people just to manage this process better, we're going to retain the public still coming to us and contain them. Postnatal depression. You know, you've just given birth. Your hormones are all over the place anyway. We're trying to stop your breast milk because you've lost your baby. So it's compounded by all of this. And professional burnout. We're traveling to SASOG tomorrow, the next day. It's showing that doctors and professional staff are burning out and presenting with depression. Not because they don't want to deal with this, because they don't know how to deal with this. And we need to train staff in how can you be with the mother there. You will never know what it's like. I will never know what it's like to lose a child the way a lot of you ladies here have. And God forbid, I never want to. But we need to be able to contain the people we work with and admit that. And I say to you ladies, I really respect you. I wouldn't be standing here if it were me. And somehow you have made all of this have meaning in your lives, and you've all gone on to go and make support groups and be passionate about this topic. And I salute you in my talk, all of you. Thank you.